Hi, and welcome to another episode here of The Nursing Show. And we are here talking about our favorite topic in nursing, informatics, right? You know, healthcare resources and digital health and things like that. Well, let's look at what this does for public health. We're going to be talking with Roland Gamache and Jack Herman here from NACCHO, and they have an upcoming conference on informatics and public health. And this is how our digital health reports that we do for our patients all go into the ether somewhere, and how they get shared around to the various agencies, not just between doctor and hospital or healthcare facility and another healthcare facility, but really public health has an important stake in having access to some of that information too. So Jack, do you want to kind of kick off and talk a little bit about why public health and informatics are such an important part that need to come together?
Yeah, I think the field of informatics for some is very obscure. What does that really mean? Are we just collecting data? Are we analyzing data? What does informatics really mean? And for public health, it really is a tool. It's a tool to help us understand when there might be an emerging illness or some other kind of threat in a community that allows us to detect it and potentially mitigate it quickly. It also means the ability to keep records in a way that allows the public health and healthcare communities to utilize that information and data more quickly and efficiently. So I think we're looking at this field of informatics, especially public health informatics, in a variety of ways that provide public health departments across the country with the tools that they need to do their work.
Really important, some of the things Jack said about using the secondary use of information that's collected for clinical uses primarily, and then we can use it in a secondary sense and aggregate that information across the population, and then we can do things to help do prevention activities in the community. We can track diseases. People who have real robust informatics programs now have been able to detect disease outbreaks in their community and stop them the day that they occur.
Right. Wow.
And then you can also look at things like flu trends over time when the flu epidemic is starting, and try to do mitigation efforts and tell people where they need to get vaccines and what kind of vaccines might need to have available. And you can send that information not only back to providers again, but also to schools and to businesses to let people know what's going on in the communities.
So there's really an important preparedness component to having access to these informatics and resources.
Yeah, I can think of a few very real ways that informatics can be used from a preparedness perspective. So put yourself in a situation where there might be a bioterrorism event, and through various kinds of technology and data coming in, we may be monitoring admissions to an emergency room with a particular symptom. And that information, if public health professionals have access to it in a real-time way, can see the clustering of those symptoms, and that might be able to allow us to detect early on there might have been a release of an agent, a bioterrorism agent, that we can begin to respond to and ensure that life-saving medical countermeasures get out to that community right away.
In fact, we have a couple presentations at the conference coming up at the end of the month that actually address some of these issues and talk about some of the responses, not to terrorism events per se, but to certain events that occurred, like Hurricane Sandy and conditions like that, where they use this information then to help mobilize the community and get the resources where they needed to be at the time the event was going on.
Health departments that may have relationships or partnerships with pharmacies in their community might be monitoring the data that comes in from those pharmacies and see trends up of people using, let's say, Pepto-Bismol or other kinds of medications, and be able to detect maybe a foodborne outbreak or some other kind of illness.
And there's so many ways that a disaster or an event can affect the community that really at the public health level becomes very important to have access to this information as close to real time as possible. I think back to the chemical release in the river in West Virginia earlier this year, how that affected that community, and you could I could see the potential for how symptoms could, potentially in that type of situation start to crop up before you even knew there was a release.
That there was something going on. Yeah.
And again, that was one where people used their syndromic surveillance systems to help respond to what was happening in the community and how to get information out and the different mechanisms they could use and they had to use to get information out because they couldn't turn the water off. You needed it for, fire protection and other kinds of conditions. But you had to let people know not to drink the water, not to bathe in the water.
Right.
And there's another area of informatics that I think is relevant in preparedness, and that is the use of electronic health records. Over the last number of years, we've been seeing healthcare facilities and other institutions that are transitioning from paper records to electronic health records. And for example, out in Joplin, after the tornado there and the loss of the hospital and those paper records, they were able to turn to their electronic healthcare record system and access the health records of patients and other members of the community who might have been injured during that tornado.
Yeah, and we talked to one of the Missouri disaster response doctors that went in and put up the field hospital that covered that hospital's resources and community while they were trying to recover from that event. And he talked a little bit about the access to those resources were available. It's interesting you mentioned Joplin because we just on the podcast last week did an interview with that physician. So it's amazing how the accessibility of these records can be so important. And so informatics and preparedness is not just about keeping those records on site. Obviously, you need to have backup.
Exactly.
You need to have maybe cloud access or some other resource, because if your facility is damaged beyond the point where you can recover those records on site, there needs to be a way to recover them.
Absolutely.
So it's 2 points. It's not only the surveillance of information, trying to find out what's happening in the community, but it also provides a mechanism for public health and for healthcare to better respond to what's happening.
And resiliency, which is an important thing to think about with preparedness as well. The community resiliency is higher when there's a better implementation of informatics across the various parts of the healthcare system.
Absolutely. We're dependent on that information. I mean, we saw in Hurricane Katrina where people evacuated that area, went to other parts of the country, ended up in healthcare facilities and primary care physicians' offices with no medical records and not really good knowledge of their medical and physical history, leaving that healthcare community at a loss for how to treat those individuals. And so this emergence of electronic health records and other informatics technology really allows us as public health and healthcare professionals to have better access to the information to take care of people.
So this conference is coming up in a few weeks from now? Or
Yeah,
the
April
end of the month?
29th to May 1st here in Atlanta.
And it's a biannual conference, so it's every 2 years.
It is.
But it really, is this something that public health informatics experts should be really looking to come to?
Yeah, this is an important conference for the field. It's co-sponsored by NACCHO and the CDC, and it brings together public health informaticians, healthcare informaticians to learn about some of the new research in this field, but more importantly, to share best practices and resources in informatics.
And that's a big component of the meeting is it's a public health practice meeting where people share their stories about what worked, where they had issues, and what you can do better to overcome some of the issues that they had when they were doing an implementation, how they could do prevention activities, what kind of surveillance activities were they able to detect, and what were they able to do when they detected an outbreak. So all that kind of information is shared at this conference, and it's probably one of the first actual practice, public health practice conferences that was established and made a big impact in public health and sharing those kinds of stories.
And that's important because you help smooth the road for the next guy when you share those practices. I talk all the time. It's one of the reasons I think resources like this podcast and other things like it are so important, because this networking that you get at these conferences is really how you can better implement in your system.
And the other component of it is it's not just public health practice people, there's also an academic component as well. So we get that interaction between academia and getting what research is happening in the academic institutions into public health practice so that we can start implementing some of the things that are happening in our institutions. And talk about the workforce development as well, and what are the skills that the public health workforce needs. And so we get an opportunity to talk to our academic partners during this meeting also.
Where can people find out more information about this conference?
So on our website at www.phiconference.org.
phiconference.org. Excellent. Well, Jack and Roland, thank you so much for joining me and sharing a little bit about what people think is a very dry topic, but actually when you dig into it, there's some good meat there.
Absolutely.
Very exciting topic.
Definitely. And I want to thank all of you for checking out this episode of The Nursing Show. This segment is from the Preparedness Summit, brought to you by our partners and friends at NACCHO. You can find out more about their various efforts to improve public health at the local level by visiting them at naccho.org. That's NACCHO.org.